The next speaker is Dr. Hari Conjeevaram. He is a professor of medicine at the University of Michigan in Ann Arbor, and also the fellowship program director for gastroenterology fellowship program. He has won numerous awards, both at the University of Michigan and outside, and more notably, recently awarded the Golden Humanism Award. He is engaged in delivering healthcare, ideal healthcare, in situations involving natural disasters. So he's been to the Philippines, to Indonesia, to Sri Lanka, to Haiti. And one of the hallmarks, I think nowhere else in the field of healthcare is the adage true than in natural disasters, that healthcare delayed is healthcare denied. A disaster strikes and nature strikes mercilessly, as we have seen and as we are seeing in Houston right now. So he engages and is part of a committee that works together to deliver that health care in a timely fashion and sustain it over a very long period after most of the NGOs have even left the country. So the goal is to be able to get people back on their feet. So I'll request Dr. Hari.
Good morning, dear brothers and sisters. It's a great honor to present the information on behalf of everyone on humanitarian relief for natural disasters. I'm going to focus mostly on the medical aspect of this work. Sathya Saibaba says, be alert to the call from everywhere and at all times. Look for opportunities to relieve, rescue, and resuscitate. Train yourselves so that you may render help promptly and well. Service is the most rewarding form of spiritual discipline, the most satisfying and the most pleasant. It springs out of love and it spreads love abundantly. And I think this is very important for me personally, for each of us. So if you have the opportunity to really jump in and let the course take itself, I think we can offer a lot to everyone who is in need. Over the years, the SSIO has been providing various expeditious humanitarian relief services worldwide. And I'm not going to go into details with the numbers. You can refer that to the book. But I really wanted to focus on some of the key aspects, what we have learned over the years. In 2014, the organization has formalized planning and guidelines for providing disaster relief globally through the formation of the International Disaster Relief Committee. The primary objective of the IDRC is to develop a core disaster relief team in each country who can provide prompt relief in natural disaster situations. Also, it's required to establish and maintain guidelines and disaster relief training requirements for the international organization worldwide so that we can work together where the need is. When we think about phases of disaster recovery, again, focusing on medical, we can think of it in different aspects. The first one is search and rescue, the immediate, saving lives, and a lot of the big organizations have been very good at this. The next one comes emergency relief, providing basic needs, whether it's first aid as healthcare professionals, or really helping and assist the local people. For example, in Haiti when we went, there was a lot of need for anesthesiologists and orthopedic surgeons. So the Psi physicians were able to help in the local hospitals. We're actually helping where the need is. Then followed by early recovery. Here we talk about sustaining basic needs and short-term recovery. And this is in the form of medical camps, whether it's medical or psychological help or other aspects of it. What is very unique about the Sathya organization has been that whereas a lot of organizations, this component is very short-based, that is usually about 3-4 months. We've been able to sustain this very long term. For example, in Haiti, we were offering relief work on a weekly basis for more than a year in 2 churches, and I'll talk about that in a minute. And finally, long-term recovery. This is where I think it's also important not to just do what's needed right away, but try to figure out, are there things that are indeed needed? And this may have nothing to do with the calamity, but investing in the community that we went to help. And in this regard, local clinics and the maternity clinic Dr. Reddy talked about in Philippines has been a perfect example. I want to start with Katrina. It goes long back. What was most inspiring to me and to all of us in this room is that this was a project which was really started by the young people, the young adults. There's a lot of young adults in this audience today. They were the ones who said, we need to do something. And me as an adult doctor followed them and went to where the need was. I also learned a lot of things in this, relief in the US, that most states, or actually all states, give temporary license to physicians if they want to work in a disaster relief area. In fact, all workplaces, whether it's private practice setting or academic setting, actually provide immediate medical practice coverage for physicians when an area has been designated as disaster relief. That's 100% for all doctors. So we don't have to worry about these things when we help people in the US. And important to keep in mind is that when we are thinking of helping others, sometimes we want to go as a group. We'll wait for that group to occur before we went for help. But I think it's very important for us to realize that if your heart tells us to go help, to do it. And I want to show a good example. In Katrina, the day I went, I was the only physician in this free clinic. And if I had not gone that day, the entire clinic operations would not have happened. There were nurses, medical students, so many others who were there to help, but they could not have done the work without a licensed physician. So me being there that particular day really made a difference. So I think when we think about helping others, we need to think in that aspect. It's very important. Each of us can offer a lot. The Haiti effort was, to me, remarkable, both from an individual perspective, but also from an organizational perspective. What we realized was that not only for the first time, several countries within the organization came together to help, we also took advantage of these huge organizations like United Nations and USAID who really went out of there to help us as a small, especially in the medical field, organization to take care of the people there. We took advantage of the local community who went around and actually organized camps for us and partnered with a huge organization called Direct Relief International who's been helping us over the years in Sathya Institutes, who actually provided us more than $500,000 worth of medications for us to do the work in Haiti for more than a year. So I think this really showed us by partnering, we can actually do much, much more. Also, it showed that when we think about medical help, we really need to think about in the bigger context, like we think about the whole body. We have to think about not only just giving medicines with love and compassion, but also what goes around it. There was an example of a patient. I said, you have to take this medicine 3 times a day. And the patient looks at me and says, how can I take it? I actually don't have water. It made me realize that when we're thinking of help, we need to think more globally. These are just pictures of some of the work. We're very involved in not only these 2 churches throughout the year, but as our previous speakers have talked about, focused on mental health and also general well-being as well. In Philippines, what we realized was, unlike in Haiti, we went there and we helped where the need was. In Philippines, the organization was that you had to go to each community, find out what the needs are, and actually work with the local governments to actually make that happen. So the model was very different. So you need to understand in each area where it is. Whereas in Haiti, what impressed me most was at an individual level, the importance of faith and spirituality of the local people. In Philippines, it was the aspect of community. They really rely on the local churches to give them hope. So I think it's very important for us to be very sensitive to the local cultures wherever we go to help as well. And this is a clinic which we talked about earlier. In the past 1 year, more than 12,000 individuals have been served during this effort. So what are the lessons learned over the years? As I mentioned, I'm not going to talk about all the hundreds of thousands of people we helped during disaster relief, but there's a lot of strength in unity and inclusion, not only inclusion of ourselves, but the local communities as well. Importance of partnering. However, very important to maintain the principles and guidelines of the organization. We don't accept money. There's a lot of things we do in a very respectful and loving way, and that has to be the core principle irrespective of how much we partner with others. Think about short and long-term relief as well. I think it's a great investment in the community and not just do the immediate effect and leave. Look at the local needs and also understand the local rules of practice. In this regard, I want to introduce, I'm not going to talk about details, about the National Disaster Relief Team of the USA. As I mentioned, the International Disaster Relief Committee wanted each country to come up with guidelines which pertains to their own country. So this has been recently formed. You can hear more about it during the workshops, and we'll also be distributing information about it. So this pertains mainly to the US and how we can work as a group. I really believe in this. I think it's very important for each one of us to have faith, not only in ourselves, that we can actually do things together, to provide hope for those in need with a lot of love. And I think the ultimate message is love. And I use this motto all the time, to not only for myself, but I really think it pertains to all of us. Just do it. Thank you.